Hello everyone, myself Bhawna Verma. I'm working in Safdarjung Hospital as a lactation nursing officer and an IKMC trainer. I have completed my BC and MSc nursing from RK College of Nursing, that is Rajkumari Amritkar College of Nursing, and I'm a PhD nursing scholar also. Today, I would like to say, first of all, thank you to the whole NNF team for providing me this opportunity to be the part of this national NNF Presidential Action Program 2025. So before starting this session, I would like to share my experience that for the past 15 years, I have had the privilege to working closely with these mothers and newborns that are admitted in mother newborn care unit and neonatal intensive care unit. So every day I witness not just the science of medicine, but the strength of the mother, the fragility of the new life, and the incredible power of the breast milk. I have seen mothers in tears worried that they are not producing enough milk and then watch their faces light up when they learn the simple technique of hand expression, realizing that their body is capable and they are producing a precious milk that is for their babies. So these experiences have taught me that the breastfeeding is not always easy, but with the right support, education, and encouragement, mothers can overcome even the toughest challenge, whether it's a nipple pain or or any kind of engorgement, nursing strike. So today I want to share just not just the techniques of but also the heart of that support the mothers, that is hand expression, safe milk handling, and managing common breastfeeding challenges, that they actually transform the doubts of the mothers into their confidence. So let's quickly start with the session. First of all, the highlights of the today's presentation is I will explain regarding the importance of breastfeeding, lactation management unit and comprehensive lactation management center. Then I will explain manual expression of milk and demonstrate electric breast pump use. I will also explain regarding the standard operating procedures related to lactation management unit, then describe the breastfeeding and common counseling that is to be given to the mothers, along with nursing strike and common concerns and challenges specifically dealing with inadequate milk perception. So these are the highlights of today's presentation. Now to introduce this topic, we all are very much aware about this exclusive breastfeeding actually prevents 13% of under 5 deaths globally a year. And early initiation within 1 hour and exclusive breastfeeding actually reduces 22% of neonatal deaths. And according to Indian statistics also, we know 27 million babies born annually. Out of them, 3.5 million were preterm and 7.5 million are low birth weight babies. So 47% babies accounts for small for gestation age. So the big challenge is direct breastfeeding often not possible for these preterms or low birth weight babies. So the solution is express breast milk, preferably from the biological mother, that is mother's own milk, mom, is the best alternative. Next is the we will learn first the feeding practices that is given by WHO for newborns from best to worst. So we are very much very well aware about this. Breastfeeding is the best technique or is the best milk for the baby, that is mother's own milk. Next is a donated fresh or preterm or term milk, that is fresh means it is expressed and it is given to the baby within 24 hours, and in the later slides I will explain regarding how to store them in refrigerator as well as in deep freezers and the temperature which is related to that. Next, coming to the feeding practices after this donated fresh term or preterm or term milk, that is pasteurized donated breast milk, which is provided in the comprehensive lactation management centers. And then comes to the preterm formula or the ordinary formula, which is we are actually giving in the neonatal intensive care units. So best milk is for the baby is mother's own milk. And now coming to the levels of facility based on these lactation management services. So first is this is actually the hierarchy of lactation services. So it is the structure which is divided into three tiers. This hierarchy explains how lactation management services are organized at different levels or facility levels from, you can see in this triangle, that from the medical college district hospital to the down to the all the delivery points. So first in this is comprehensive lactation management center, which is there at all the at the district hospitals with medical college and with NICU. Next is the lactation management unit, which is at a district hospital or large sub-district hospital with functional NCU. And lactation support units, they are the corner which is all given in every area of delivery room or at all delivery points. This is for support and early initiation of breastfeeding, as well as for early initiation of kangaroo mother, that is skin to skin contact for the baby and the newborn. So there is a manual. The reference I will provide you in the later slides, that you can also download these CLMC, LSU organization and functioning of how they function. This is a reference I will provide in the later slides regarding this. You can download and learn in detail. So next is the definition of comprehensive lactation management center, that this is the facility which the core feature of this is collection, screening, processing, storage and dispensing of donated human milk. And this donated human milk, that is for babies without access to their own mother's milk, and expression and storage of mother's own breast milk for consumption of their for baby are available in the comprehensive lactation management center. So basically 4 processes are running in this CLMC: collection, screening, processing, and fourth one is storage and dispensing. Then comes to the lactation management unit. We know that it is established at district or sub-district level with a functional SNCU with at least 12 beds where sick newborns are admitted. So here the functioning of this is the collection and storage facility of mom, that is mother's own milk, to fulfill the feeding requirement of the admitted sick mothers. Now coming to the, I will explain in detail about this lactation management unit. Then the saline features of this is, first is the no screening of mother is required, as babies are fed by the milk expressed by their own mothers, and emphasis on milk expression, counseling, support for better letdown along with use of electric and manual pumps, careful labeling of expressed milk and supervised dispensing, and the pasteurization and also the testing of milk is not required. Whereas we have seen in the CLMC, Comprehensive Lactation Management Center, here the pasteurization and testing is done. That is the processing of milk, donated milk and dispensing. So in the LMU, we don't need, we just give the mother's own milk to the baby, to their babies, which is expressed by either by hand or by electric breast pumps, and proper counseling and health education is given to the mothers regarding the expression of milk and the importance of early initiation of breast milk also. Next is the role of lactation nurse in LMU. So overall supervision of functioning of LMU is the main responsibility, and under this the routine rounds, that is with the lactation support to the mothers and motivation and counseling which is given by the lactation nurse in the LMU, facilitating and helping mothers in milk expression and providing sterile gowns, sterile bottles and tubing for breast pumps. So these all are the responsibilities of a lactation nurse. She would carry out cleaning and sterilizing of the equipment and ensure proper storage and dispensing of milk, bottle labeling and record keeping. These all responsibilities I will explain in the standard operating procedures which is related to LMU in the later slides. So next is the counseling, which includes hand washing, personal hygiene information of milk expression, suitability of each method, and collection of different techniques, cleaning of breast pumps and other tubings. The preparatory activities are also the main role of lactation nurse. That is, first of all, regarding the personal hygiene and the shower, that she must be, her breast must be cleaned properly, privacy should be maintained, and expression of the milk, that is by hand or by electric breast pumps, are actually done by under the guidance of this lactation nurse, and for that which results in better volumes of milk expressed, and are these all techniques should be painless and comfortable, that the mother can be used easily in the lactation management units. Next is the expression of breast milk. There are two methods that we all know. First is the manual expression and the second is the expression using breast milk. First is the manual expression. So in this, we know that hand expression is usually gentler than a breast pump. Hand expression appears to produce a more oxytocin response and milk ejection reflex. In a hospital setting also, lactation counselors or nurses should teach the mothers the art of expression of the milk. Education of the mothers regarding holding, cuddling, and handling the baby, so that we just explain the mother that you should keep your baby in your lap, so it will stimulate the let down reflex. Alternatively, take a few breaths and relax for a few at least 5 minutes before extraction of the milk. So sit comfortably and hold a clean container near the breast. This is the technique. And place the thumb and index finger on the breast around the areola opposite each other. Support the breast with the other three fingers and press thumb and index finger gently inwards towards the chest wall. Press the breast between the forefinger and the thumb and press and release. And this should not hurt the breast of the mother. Then the next is the press areola in the same way from sides to ensure the milk is expressed from all the segments of the breast, and avoid rubbing and sliding fingers along the skin. Express one breast for at least 3 to 5 minutes until the flow slows. Then the express milk from the other side, and then repeat the process. To express breast milk adequately, it may take 20 to 30 minutes. So this is all about the theory. Next, quickly we just see the before manual expression. We know wash your hands with soap and water. We should explain all the techniques of hand washing along with the 5 movements of hand washing which is given by WHO. Next is you can see there is a technique which I have already told you, and you can quickly grab this process by seeing.
इस वीडियो में दूध को कैसे निकालते हैं ब्रेस्ट से, इसके बारे में दिखाया गया है। सबसे पहले माँ को अपने ब्रेस्ट को धीरे से मसाज करना चाहिए। देखिए, जैसे चारों तरफ मसाज करें, खास तौर से काले हिस्से को छोड़ दें और ऊपर से काले हिस्से की तरफ को अपना फिंगर का मूवमेंट करें। इसी तरह से चारों तरफ करें, ऊपर भी, नीचे भी, चारों तरफ। बच्चे को अपने पास रख सकते हैं, इससे दूध निकालने में दूध ज़्यादा मात्रा में निकलता है। देखिए, दूध निकालने का तरीका ये है कि अंगूठे को काले वाले हिस्से के ऊपर और इंडेक्स फिंगर को, जो पहली उंगली है, उसको काले वाले हिस्से के नीचे रखें। फिर हम पीछे की तरफ दबाएं, छाती की तरफ दबाएं और फिर इसको स्क्वीज करें। तो आप देखेंगे कि दूध जो है वो धार की शक्ल में बाहर निकलता है। 3 से 4 धारें निकलती हैं। एक चीज आप देख रहे हैं कि फिंगर्स को, उंगलियों को निपल के ऊपर रोल अप ना करें। ये दूसरा दिखाया गया है मसाज का तरीका कि आप चारों तरफ से, ये इसको नीडिंग कहते हैं, इस तरीके से भी आप मसाज कर सकते हैं, ब्रेस्ट का मसाज कर सकते हैं। और फिर वही टेक्निक रखेंगे कि हम मसाज करने के बाद यहाँ भी बच्चे को अपने पास रख सकते हैं। सामने बच्चे को रखने से दूध ज़्यादा निकलता है। यहाँ भी आप देखेंगे कि माँ ने एक अंगूठा काले हिस्से के ऊपर रखा है और उंगली नीचे काले हिस्से के नीचे रखी है और हल्का सा अपनी छाती की तरफ बढ़ाते हैं और फिर उसके बाद दूध निकालते हैं। चारों तरफ से दूध निकालना अच्छा रहता है। चारों क्वाड्रेंट से दूध निकालें, जैसे यहाँ ये माँ कर रही हैं। दूध ड्रॉप्स में भी आप निकल सकता है और सेट के साथ भी आएगा। आप देख रहे हैं हल्का सा पीला रंग है दूध के अंदर। ये माँ का दूध जो है वो पीले रंग का होता है। अब दूध निकालने के बाद में इसको नर्स जो है वो कप के जरिए से दूध पिला सकती है। बोतल का इस्तेमाल नहीं करना चाहिए। आप यहाँ देखेंगे कि एक बच्चा है, नवजात शिशु है, और इसमें आप जो कप कटोरी है उसका हिस्सा इसके नीचे वाले होंठ पे रखें और इतना ऊपर उठाएं कप को कि जो उसका दूध है वो लेवल जो है उसके ऊपर वाले होंठ से टच हो जाए, बस। फिर आप देखेंगे बच्चा खुद से दूध पीता है, अपने जबान से वो दूध को अपने अंदर लेता है और बहुत आराम से दूध पीता है। देखिए ये एक पूरे दिन का बच्चा है जो कि वजन कम है इसका, इसको भी इसके माँ ने दूध निकाला तो इसको नर्स दूध पिला रही है। यहाँ भी आप देखेंगे कि बच्चे के सामने रुई रख लेते हैं ताकि थोड़ा बहुत जो स्पिल ओवर होगा मिल्क वो ना गिरे, और इसकी जो कटोरी है इसको नीचे वाले होंठ के ऊपर रखते हैं और इतना ऊपर उठाते हैं कि ताकि मिल्क का जो लेवल है वो ऊपर वाले होंठ से टच हो जाए, और बच्चा फिर आराम से दूध पीता है। ध्यान रखें कि दूध को उंडे लेना मुंह के अंदर, थोड़ा सा हाथ नीचे लगा लें सर पे, थोड़ा ऊंचा कर लें सर को, 30 डिग्री ऊपर उठा सकते हैं, और फिर बच्चे को दूध पीने दें। यहाँ पर माँ अपने बच्चे को दूध खुद से पिला रही है। वही तरीका, वही टेक्निक कि जो कटोरी है उसका नीचे वाला हिस्सा जो है वो नीचे वाले होंठ पर रखें और मिल्क का लेवल जो है वो टच कर दें। आप देखते हैं कि बच्चा जब दूध पी रहा है तो इसमें वो बबल्स भी निकल रहे हैं, इसका मतलब ये अपनी ज़बान से ही बच्चा दूध को खींच रहा है। बच्चे को अभी तक हम नली के द्वारा दूध पिला रहे थे, तो अब मदर, अभी तक नर्स ने दूध पिलाया, अब उसकी माँ को हमने सिखा रहे हैं कि वो कैसे दूध पिला सकती है बच्चे को। बहुत छोटा बच्चा है, आज 10-12 दिन का हो गया है, और अब वो दूध अपने हाथ से पिला रही है। आपने देखा कि ये माँ बार बार उसको होंठ खोलने की कोशिश कर रही थी, तो नर्स ने उसको रोका कि ऐसा ना करें, बल्कि बच्चे को खुद से दूध पीने दें। अगर वो भूखा होगा तो दूध पिएगा। देखिए अब उसने मुंह खोला है, और वही टेक्निक कि नीचे वाले होंठ पे हम कटोरी रखेंगे और मिल्क को टच कर देंगे ऊपर वाले होंठ से, बच्चा दूध पीना शुरू कर देगा। ध्यान रखें कि दूध को मुंह के अंदर उंडेलना नहीं है। तो इसमें क्या होगा कि बोतल से दूध देने की ज़रूरत नहीं है और बच्चा डायरेक्ट कप से दूध पिएगा, इसमें चम्मच की ज़रूरत भी नहीं है। देखिए ये वही बच्चा है जिसकी कि नली हमने निकाल दी है, और अब ये डायरेक्ट दूध जो है वो पी रहा है कप के द्वारा। इसमें एक फ़ायदा ये होता है कि जो बच्चे कप से दूध पीते हैं वो जल्दी फिर अपने माँ की छाती से दूध पीना शुरू कर देते हैं। कुछ दिन में इस बच्चे को हम माँ की छाती से लगाएंगे और वो फिर वहाँ से डायरेक्ट दूध पिएगा।
This is all about the expression of milk by hand. You have seen the how the mother as well as the nurse is giving feed to their babies. So now coming to the expression of milk using electric breast pump. So we know that according to hospital policy, there are different breast pumps which are used in this lactation management centers. So there are number of designs, all of which have a funnel attachment which fits over the nipple and areola and work on a simple vacuum principle. Electric breast pumps are efficient and can adapted to allow single or double pumping. However, bulb type pumps are strongly discouraged as they carry a high risk of contamination. So we should explain the mother that these bulb type pumps are to be avoided. The technical specification of electric breast pumps are given in the SOPs that I will explain later, and the user's guide is given with all the electric breast pumps that according to the hospital wise and according to the manuals that are provided in the breast pumps are to be used. Next is it is recommended that the baby should keep close to the mother as they would help in the let down reflex. So while the mother is expressing milk using these breast pumps, they can carry the baby in their lap, and a maintenance cleaning of electric breast pumps and all of the accompanying accessories is critical to prevent contamination and potentially serious illness as a result. So cleaning must be done properly. It is also important that the mother is shown how to position and use the breast pump to avoid damaging her nipples or areola, and each mother should be provided sterilized tubing, funnel and milk container. So these principles are to be this principle is to be strictly ensured that there should not be no sharing of breast pump, funnel, tubings and milk containers also among the mothers, because we explain this to the mothers also that only single use breast pumps or their tubings or accessories for one time use is for the, if the same tubings or accessories is to be used for the next mother, then they should be properly sterilized. I will explain how they are going to sterilize. Next is the important instructions while using these electric breast pumps. So first is always remember to switch the pump off before removing the funnel from the breast. Double pumping reduces time of expression by 10 to 15 minutes and also allows for higher prolactin reflex, which results in higher amount in less time. Pause for 30 to 60 seconds when the milk slows down. So this is there in the breast pump. You see there are the two settings. First is for let down reflex, that is the slower pumping, and the second one is the fast pumping. So the second one actually produces the milk in higher amount because it allows for higher prolactin reflexes. So I will explain this more clearly with the video that in the later slides I will show you. So next is the stop pumping after 20 to 40 minutes or when the milk is stops flowing down. Milk donation should never be painful. Donation means if their mother is expressing milk. So if the correct technique is told to the mother, then there must be a painless breastfeeding expression by using these pumps. So if the mother has delivered the baby recently and is secreting colostrum, it is advisable to express by manual expression only, because we all know the colostrum is in very small amount. So if it is expressed better with the use of hand, so there must be a painless technique which should be told by the nurses. So only electric breast pumps with an isolated motor which does not connect with the tubing are suitable for multiple use. Here, each mother should have her own set of tubings that I have already told you regarding this. Express minimum 8 times a day or 100 minutes per 24 hours till the baby starts to breastfeeding. Mothers should be encouraged to express milk from both the breasts completely each time to maintain the milk output. And the last is, in all cases, the milk should be donated in the specified room in lactation management centers. Now coming to the standard operating procedure of hand washing. We all know that the purpose is to enable the mother for safe handling of the milk, as well as if it is there to prevent the infection. And the responsibility of this is obviously it is the responsibility of lactation nurse. And so before, not, it is not about the hand washing, it is about the how the mother gain confidence by expressing the milk either by hand or by using electric breast pumps. So there must be a painless expression, there must be a building of confidence within the mother. So these all are responsibility of lactation nurse. So the procedure is to be explained to the mother, and here are the steps of hand washing. That wet hands under running water, apply adequate amounts of liquid soap to hands, rub hands palm to palm, place right palm over left hand and lather soap between the fingers, place left palm above right hand and lather soap between the fingers. These all techniques just I'm listing down, and we all are very much aware and we are explaining to the mothers also. So, so these all are the techniques. So I will not going in detail of this. So next quickly comes to the procedure that is for registration of the mothers or counseling of the mothers within the lactation management unit. So first explain the procedure of breast milk expression and breastfeeding to the mother. Ensure the mother understands the benefits of breastfeeding and expression of milk. Ask the mother if she is having any questions or queries regarding the same, and enter required details of mothers in the LMU register and take the mother for the hand expression now after registration. Next is the standard operating procedure, which is related to use of this electric breast pump. So the purpose is obviously to express the breast milk. Responsibility of this is the main responsibility of a lactation nurse, and the nurse actually follows the proper procedures following the correct cleaning technique of the breast pumps also. Next is the what is the procedure involved in this. First, ensure the hand hygiene is followed by the mother. Assemble the clean and sterile dual Lactaset shield at the bottle and attach them with the pump. Next is ask the mother to place the funnel of the Lactaset over the areola and surrounding breast, making a firm and airtight seal. Using the dual phase pumping, which have the inbuilt settings for stimulation phase and the maintenance phase. These two phases I have already explained you. This there is a two phase. With the video, it becomes more clear. The mother should pump on both the breasts, each for 15 to 20 minutes, depending on the system of the pump, and for 2 minutes after milk has stopped flowing. Do not remove the funnel from the breast while pumping is still in process. And caution is to take care of this, to watch that there must not be any backflow of milk in the tubings. So connecting these lactasets very carefully. If there is any black flow, then immediately switch off the machine. Next, these are the parts of electric breast pump. The first part is the here is the pump which I have used. So let's quickly see its video so that it will become more clear about the use of these electric pumps. So here we open these breast pumps, and in this there are the there actually we place two cups, which is which we can use it for the same mother, and we can use for the different mothers also. But be ensure this that one set should be used for one mother. So there after this we attach the tubings with the cups, and then closing this. Then with this tubing we took one bottle. In this we attach here is a there is a connector. We attach each connector with the each bottle. Then with this we are placing a diaphragm over the connector. This is the diaphragm which actually prevents the backflow of the milk into the breast pump. So we attach the shield. Here it is known as a shield, and again completing the set with the attaching the tubings. Then our set is ready. Now there is a one switch on the left hand side. There is a switch on and off. So we are going to switch on this, and manually we can increase the pressure also. Here you can see, you can hear the sound also. And on the right hand side there is a switch related to two phases that we have that I have already explained you regarding the stimulation phase and the maintenance phase. So the main we should take care of about handling these breast pumps is, first, after attaching the shield to the shield or funnel to the breast, then only we should start the pump. And after just you should not abruptly remove the shield from the breast. First switch off the pump, then remove it, so that there should be a very painless and comfortable expression of milk by the mother. The next is how to clean this breast pump. So all the breast pumps, including that you have seen the funnel, valve, receptacle, bottles of lactasets, except tubings that come in contact with the breast, must be dismantled and immediately after each use. So these parts must be rinsed and washed with the soap and water and let it dry. Sterilize the tubings and its connectors for 10 minutes as per manufacturer's instruction, and place the breast pump accessories on a clean paper towel or on a clean drying rag or a sterile towel and allow them to air. It is important that all residual moisture dries. Do not store wet parts in an airtight container or a bag. So the all the equipment which is enclosed with attachment of the breast, that should be sterilized by proper boiling or after cleaning it with soap and water. So the main point is the tube which is left should be handled in such a way that it does not come in contact with the breast milk. There is no visible residues in the tubings. No cleaning is needed. If the residues are visible in the tubings, then then follow the above mentioned instructions, like if there is a 1 or 2 drop of milk is present in the tubing, then quickly we should wash it with soap and water and then hang it over the night so that it completely gets dried off, and there should not be any single drop of milk or any kind of water. So this will maintain properly the our breast pumps in a long run also. Next is standard operating procedure, which is related to for the sterilization. So for the sterilization of these lactosets, all lactosets which were in contact with breast milk must be washed with soap and soap solution. After washing them and boil the bottles and pumps for 15 with RO water. And once the lactosets are completely boiled or dried after boiling, put a sterile sheet in a stainless steel drum. So only one lactoset should be taken out at a given time for the expression of mother's milk with the help of a chital forceps from the stainless steel autoclave drum, only to avoid contamination and spread of infection. So this is all about the sterilization. So all the procedures that I have already explained you are written here in the procedure that ensure cleaning and sterilization of all lactosets. The lactation nurse involved in milk collection should wash her hands and wear gloves and sterile apron. Note mother's detail in the LMU register. Ask the mother to wash her hands prior expression of the milk. Mothers expressing milk in a hospital may be asked to clean her breast with a swab of normal saline or RO water moving inside toward outward from the areola, and assist the mother to take a comfortable sitting position. Ask the mother to place a funnel of sterilized lactosette over the nipple or areola on both the sets, breast or a single breast, and to hold it firmly over the breast so as to make an airtight seal. Next is the standard operating procedure, which is related to milk collection at hospital setting. That is, switch on the pump and set it on a stimulation or expression mode as required. Continue for 15 to 20 minutes, and it may take time before the milk starts flowing. So as the milk ejection, that is oxytocin reflex, is activated, the human milk will flow, and it will take 15 to 20 minutes to express the human milk adequately. Do not rush. So simultaneously during expression, counsel the mothers on breastfeeding messages, and after expression is over, the milk of should be transferred to the bottles. So in this, the main thing is while transferring the milk, make sure that no other activity, including speaking, which may contaminate the expressed milk, is happening around the area. So note the volume of the milk which is expressed in the LMU register and store the container after labeling in the refrigerator till the time it is transported to the milk bank, ensuring transportation on the same day of collection. So this is all about the expression of milk, and we have labeled it also. Then about the thawing of this frozen human milk, that we all know thawing is the process of liquefying the frozen milk which is stored at -20 degrees centigrade. So thawing of human frozen human milk to the babies. So prior use of this frozen milk, it should be thawed. So it can be refrigerate. First, we should refrigerate from the deep freezer to the freezer. We should refrigerate for 24 hours and keep the thawed milk in the bottle warmer if the bottle warmer is available. So if the bottle warmer is available, once the temperature reaches 27 degree, remove the bottle and start feeding the milk, and the leftover milk should be discarded. Time of thawing of frozen human milk should be mentioned on the bottle clearly with a permanent marker. So whenever you want to give feed to a newborn or a neonate, then you should take this frozen human milk from the deep freezer where the temperature is -20 degree, and you should refrigerate for 24 hours, maximum of 24 hours, and the temperature of the refrigerator is 2 to 4 degrees centigrade. Then after this 24 hours, we should thaw the milk by using, if the bottle warmer, in many settings bottle warmer is not available where the temperature reaches 27 degree, so you can take a bowl with the warm water, and you can just quickly keep that milk which is thawed in the refrigerator for 24 hours in that warm water, so that you should not reboil it again, just so that the temperature normalizes, and then the milk is ready to give to this newborn. Now coming to the main points to be noted while thawing of this frozen human milk. Gently shake the container before use to homogenize the milk content evenly. Thawed milk should not be frozen or refrigerated again. Frozen human milk has to be consumed within 2 hours and latest by 4 hours of storing at room temperature. So the milk which is already stored for 24 hours and we have thawed it, it should be consumed within 4 hours, and it should not we should not re-refrigerate it. So excess thawed milk left after feeding the babies should be discarded immediately, and thawed milk should never be kept under radiant warmer. Next procedure is about the labeling of milk containers at collection site. So this labeling will be done manually by the nurse or a lactation nurse which is there, and this labeling will be done manually but with the use of a permanent marker on the bottles. Now quickly see what we should write during labeling. The date and time, which is in the 12-hour clock of collection, and here you can see the time and the date is mentioned. The site of collection, UHID number of the mother and the baby, both should be written on the labeling, and milk bank number. That is in our setup we are using year, month, date, site of collection, and the serial number. With this we have prepared one milk bank number, and it should be mentioned in the label. Then volume of milk which is expressed, and the time of collection. So main thing is the date and time of collection along with the UHID number of baby and the mother. This is all about the labeling. Now coming to the housekeeping, that we know these are the responsibility of a housekeeping team, but we should supervise it properly. The housekeeping supervisor in coordination with the respective department personnel would be responsible for all the housekeeping activities. The department manager responsible for overall monitoring of housekeeping program. The area wise housekeeping activities should be implemented by the respective personnel. Now coming to the materials, that we know that according to the hospital policy we are cleaning, but here is a chart you can see that is we are using in our LMU, that date, floor cleaning equipment, cabinet, sink, dustbin, wall, tube light, and sign of the concerned lactation nurse. So ensure that these all things or reports and records should be maintained. This is known as a daily cleaning log sheet format, and this the disinfectant which we are using in our hospital setup, it varies from hospital to hospital settings. So these all are the responsibility of a lactation nurse. Now coming to the records and reports which are maintained by a lactation nurse in an LMU. First is that we have already known that first registration is to be done. So mother's registration record book is to be maintained. Feeding counseling records, that includes that to how many mothers you have counseled, and what are their problems, and regarding kangaroo mother care or regarding any kind of expression of milk, if there is an inverted nipple, if there is any other problems which is related to breast is there. So all these things should be written in the counseling records. Then frozen milk storage register, in which we need to properly label all the bottles, and about the date and time which is to be which is to be clearly mentioned with a permanent marker. Housekeeping records that that in the previous slide you have seen. Then report book, that how many mothers daily census of the mothers which are attending which you are attending in an LMU. Inventory book is to be maintained. So these all are the records and reports which we are maintaining in our LMU. lactation management. These are the references which I have already told you regarding that you can download these manuals and learn about more in details regarding comprehensive lactation management centers, NLMU, NLSU, what are their organization, how many staff members are required, and the proper functioning of these areas. Now, next part of this session is counseling of mothers with common breastfeeding problems. So, before starting with the problems, I would like to tell you that breastfeeding counseling is the main core component of our teaching. First, if there is any mother, like mother is saying मुझे तो दूध आ ही ना रहा है, मुझे बहुत परेशानी हो रही है, तो there are five or six steps which if we use in our counseling in day to day, then definitely it will gain the confidence of the mother and also reduce the anxiety, and mother will become more confident, and mother can actually demonstrate how to overcome these problems. सो फर्स्ट इज एक्सेप्ट द मदर. अगर मदर बोल रही है कि मुझे बहुत दिक्कत हो रही है, तो आप उसे पहले एक्सेप्ट करो कि हाँ हाँ मुझे पता है आपको प्रॉब्लम हो रही है, हाँ मैं देख पा रही हूँ आप कितनी परेशान है. नेक्स्ट इज सेकेंड पॉइंट इज टू रिकॉग्नाइज एंड प्रेज द मदर. जैसे आप बोल सकते हो इसमें कि हाँ मैं देख सकती हूँ आप कितनी परेशानी में हो, और ये भी देख सकती हूँ आप कितना, लेकिन आपने जैसे बच्चे को लिया हुआ है, बहुत अच्छे से पकड़ा है, इसके कपड़े आपने बहुत अच्छे से पहनाए हुए हैं, और आप इतनी परेशानी में भी दूध पिला रहे हैं, ये बहुत अच्छी बात है. सो दिस द सेकेंड स्टेप इज प्रॉपर recognizing her problem and praising the mother. So this is the second step of counseling. The third is give a practical help. अब आपने देख लिया कि उसको प्रॉब्लम क्या है, फिर उसको प्रैक्टिकली आपने हेल्प किया कि कैसे उसको आप एक्चुअली उस प्रॉब्लम को सोल्यूशन आप उसको देकर और डेमोन्स्ट्रेट करके दिखा सकते हो. देन फोर्थ इज प्रोवाइड लिटिल little commanding but provide more possible solutions or suggestions to the mother. कि आप ये देखा गया है कि जो बच्चे माँ का दूध लगातार पीते हैं उससे बच्चे में बढ़ोतरी अच्छे से होती है. तो जब आप कमांड ना देके सजेशंस देते हो देन डेफिनेटली एक्सेप्टेंस उसमें मदर्स की ज्यादा होती है. द नेक्स्ट इज द प्रॉपर यूज सिंपल लैंग्वेज एंड गिव रेलिवेंट इन्फॉर्मेशन. अगर आप उसे काउंसलिंग कर रहे हैं तो अभी ये बोल के कि आपको 6 महीने तक 6 महीने बाद आपको कॉम्प्लीमेंट्री फीडिंग शुरू करना है, आप अगर आप अभी से ये बताएंगे तो वो और ज्यादा कंफ्यूज हो जाएगी बहुत ज्यादा डिफरेंट वर्ड्स यूज करके. तो सिंपल लैंग्वेज के साथ हमें 1 और 2 रेलेवेंट इन्फॉर्मेशन जो अभी उसकी प्रॉब्लम को दूर कर सकते हैं, हमें वही काउंसलिंग करनी है. अगर ये सब चीजें, ये 6 टेक्निक्स अगर हम अपने काउंसलिंग में यूज करेंगे देन डेफिनेटली मदर will get benefited out of this. So now quickly start with this breastfeeding problems. So classifying the breastfeeding problems, basically we know that maternal related problems, infant related problems, and environmental related problems are there. In the maternal related problems, engorgement, mastitis, breast abscess, cracked or sore nipples, flat or inverted short long nipples, blocked ducts, nipple trauma, painful letdown reflex, low milk supply, overabundant milk supply, and lactation failure may be there. And the problems which is related to infant, that we all know, that tongue tie, poor attachment, and ineffective suckling because of prematurity and low birth weight is there. Illness due to cleft palate or any kind of infection may be there that leads to the breastfeeding problems. And the main problems or factors which we usually see but we avoid, that are the environmental factors. If there is a lack of skilled lactation support, separation of mother and baby, inappropriate advice, formula promotion, and maternal return to work is there, then definitely these all environmental factors leads to breastfeeding problems. Now quickly see this full breast, which is normal breast, and the mother is lactating. Here is the full breast. And here in this picture, you can see the breast with engorgement. So, what are the signs and symptoms that you see in both the slides is differences in the full breast. It is hot, heavy, hard, milk is flowing down, no fever is there. But in the engorged breast, it is painful, edematous, tight, especially nipples are shiny, milk not flowing, and the mother may have fever. So these all are the symptoms you can see in the full breast or in the engorged breast. So before giving the treatment or I'm talking about the prevention, first what are the causes of this engorgement in the breast? The first is the plenty of milk. Plenty of milk is there, but the baby is separated from the mother, or the mother is not expressing milk or not giving or not starting early initiation of breastfeeding. So delay starting of breastfeeding, encouraged unrestricted breastfeeding to the mother, infrequent removal of milk, and restriction of length of feeds. These all are the causes of breastfeeding engorgement. Now coming to the prevention part, how if there is a unrestricted breastfeeding, proper attachment is there. Breastfeeding is started soon after the delivery, like within 1 hour of delivery. Then these all methods prevent the breastfeeding engorgement. Now, before this, what do you mean by good attachment and bad attachment? You are very much aware. But the main thing we forget in the mothers or as well as in the newborns is that the mothers should be relaxed and properly comfortable, sit in a comfortable position before starting the breastfeeding. Baby's body should be close to the breast and facing the breast. Baby's head and body are to be in a straight, or the baby's chin should be touching the breast, and the baby's bottom is to be supported by the mother. So this is the proper body positioning which is to be seen in the good attachment. And when we talk about suckling, so if there is a mouth wide open, lower lip turned outwards, tongue cupped around the breast, cheeks round, and more areola above the baby's mouth is there, then this is all are the signs of good attachment. So here you can see the picture also. There is a good first picture is of bad attachment, and the second picture is of good attachment. Here you can see the baby is close to the breast, and all more of most of the areola is in baby's mouth. The chin is touching the breast also. Baby is in comfortable position, head and shoulder is in a straight posture, or the baby is close to the breast also. This is all about the good attachment and bad attachment. Now coming to the treatment of breast engorgement. So first we should counsel the mother that you should not rest the breast. Instead of resting the breast, the mother should be counseled that if the baby is able to suckle, feed frequently. If the baby is not able to suckle, express milk by hand or with a pump. Next, before feed, uh, if there is an engorgement of breast, we just quickly give advice to the mother, just express the breast milk by using a hand pump, or a manual expression of milk should be there. But before this, we should explain that to stimulate oxytocin reflex, warm compression and warm showers to be taken by the mother, massage to the neck and back, that we explain the mother that you should rest and by keeping your head down, and the proper massaging is to be given to the back and neck of the mother. Then light breast massage is to be done, and stimulate the nipple skin, that you have seen in while expression of milk video, that how to stimulate the nipple and help the mother to relax. So these all should be done before expression of the milk, and after feed, to reduce the edema, cold compression to the breast is to be given. So this is all about the engorgement. Now coming to the cracked nipple. Here in this picture you can see the cracked nipple. So the cracked nipple is the loss of surface epithelium with the formation of raw area on the nipple. So fissure either at the tip or at the base of the nipple. In this picture you can see. The next is the sore nipple. So I am covering the nipple, sore nipple as well as the cracked nipple both, because these other causes and the management is almost the same. So the management of these nipples are, look for a cause first, check attachment. So I have explained to you regarding good or bad attachment. Examine breasts for engorgement, fissures or candida. In the later slide, I will explain to you about the candida, treatment of candida. Then check baby for candida and tongue tie. So both the breasts as well as the babies to be checked for candida, and any other kind of tongue tie or problem is there or not. Then give appropriate treatment. Build mother's confidence. So, how we can build the mother's confidence? By giving proper counseling to the mother. Improve attachment and continue breastfeeding. Reduce engorgement and suggest to feed frequently. Express milk manually. Treat for candida if symptoms indicate. Now, advice which is given to the mother, that wash the breast only once a day. Avoid soap. Avoid medicated lotions or ointments. Rub Hinmil on areola after feeds. So these all are the advices which is to be given to the mother. Now coming to the treatment of candida of the breast. So if there is a candida, so we can apply gentian violet paint, nystatin cream or suspensions. That to the baby's mouth it is 0.25%. Apply daily on alternate days for 5 days or until 3 days after the lesions have healed. To mother's nipple it is applied 0.5% daily for 5 days. And when we talk about nystatin cream, it is 1 lakh international unit and apply to the both nipples 4 times daily after breastfeeding and continue to apply for 7 days after the lesions have healed. So as it is similarly with the suspension also. But the main thing which we should explain that to the mothers, stop using pacifiers, treats or nipple shields. Now coming to the different nipple shapes. In this, you can see that average nipple is there, flat nipple may be there, long or inverted nipple. So first thing we should explain this to the mother, that it is not about the nipple is long or short or inverted nipple is there. The main thing which we should explain to the mother is about the protectivity of the nipple. In the above picture, you can see a short nipple. First, we should see, is it protectile or not? What is protectivity? It is the power of the nipple to pull out. If you can pull it out like this, then it protects well. If it is goes in like this, when you try to pull it out, that it is not protectile. So after checking this protectivity, then what we should do? Antenatal treatment probably not helpful. We know that if the mother is having inverted nipple or a flat nipple, then antenatal counseling is not actually helpful. But we should build the confidence of the mother by saying that soon after the delivery, whenever the baby suckle the breast or with the proper attachment, the baby can easily take breastfeeding or your nipples may be pretty out. So explain that baby suckles breast, not the nipple. Allow baby to explore breast, that is skin to skin contact is to be done. Help the mother to position baby early. Try different positions, underarm position or other positions should be explained. Help mother nipple stand out, on manual method or stimulation is to be done. So if necessary, use breast pumps or syringe method to draw nipple out and express breast milk and feed with a cup. Express milk into baby's mouth if needed. So for the first week or 2 weeks, we can say that usually in our departments also we are giving syringes with a cut it, so that these syringes pulls out and they are very helpful in inverted nipples. And explain the exercises to the mothers also regarding that you can pull it out with the finger, so that in the if the protectivity is average, so that this exercise help the mother to make the proper nipple. If the nipple is inverted, then we can give the syringe or we can say that you can express her milk by using this pump or this syringe. So this is all about the flat or inverted nipple. Next is the blocked duct. In this picture you can see the red streak extending down outward and the affected areas. This is all about the plugged milk ducts. Next is the mastitis. In this picture, you can see that there is the skin redness, inflammation of lobules or ducts, inflammation and skin redness. That is, you can see in the third picture also. Now, what are the symptoms of the blocked duct or mastitis? We know that if the duct is blocked, then milk stasis is there. This may lead to non-infective mastitis and infective mastitis. So, what is the difference between two first? In the non-infective mastitis, lump is there, tenderness is there, localized redness, but no fever, and the mother feels well. Whereas in infective mastitis, there is a heart swelling, severe pain, or reddened area is there, fever may be there, and the mother feels ill. So, how the non-infective mastitis progress to infective mastitis if the mother is not taking properly the treatment, or if the mother is not expressing her milk properly. So, this non-infective mastitis eventually leads to infective mastitis. So, in the infective mastitis, what are the in both the cases, blocked duct and mastitis, what are the causes? Like infrequent or short breastfeeds are given due to if mother being very busy, baby sleeping at night, changed routine, and mother stressed. So, in all the cases, because of the short breastfeed, it leads to mastitis. Poor drainage of part of or all part of the breast due to ineffective suckling, pressure from clothes, pressure from fingers during feeding, and large breast draining poorly. So these are all the causes that actually leads to ineffective draining of the milk. Then damage to the breast tissue, that is the trauma, if there is any trauma, or bacteria allowed entering due to nipple fissure. So if bacteria is found in the blood, it actually leads to the infective mastitis because of the nipple fissure. Now coming to the treatment which is related to the blocked duct and mastitis. First is improved drainage of breast. Then check for and correct if poor attachment, pressure from cloths, large breast drainage poorly. So if any of these, then symptoms may become severe, or fissure is there, or no improvement is there after 24 hours, then treat in with addition with antibiotics. Complete bed rest and analgesics is to be given. So what we advise for these mastitis is frequent breastfeeds, gentle massage towards nipple, warm compression, which is advised to the mother. So in the right hand side, antibiotic analgesic and rest is complete rest is given to the mother for infective mastitis. But for the non-infective mastitis, we should explain the mother, you should continue with a full emptying of the breast by manually expression or by using breast pump, or and also we can her like gentle massage, warm compression becomes helpful for her, and start feed with the unaffected sides. So what it will lead to is if unaffected side with the unaffected side, the mother is continuing the breastfeeding, then the oxytocin, the pain which is there in the affected breast, actually it reduces oxytocin stimulation. So with the continuing feed, it helps mother to reduce the pain also, and proper continuation of expression of the milk is there, and the mother can use different positions for breastfeeding. But you should explain this to the mother, either it is mastitis infective or non-infective. First, before giving antibiotics, fully the mother should be aware that she should be expressed her breast, completely emptying the breast, so that and start breastfeeding as early as possible. So this helps the mother to reduce the pain, to reduce the symptoms. So this is all about the treatment of blocked duct and mastitis. Now coming to the antibiotic treatment for infective mastitis. So we know that the commonest bacterium found in the breast abscess is Staph aureus, and the drug is cloxacillin and erythromycin. So these are the doses, and take dose at least 30 minutes before food. Now coming to the breast abscess. So here if there is an inflammation, discharge, here you can see the swollen lactiferous ducts or pus is there, then leads to the breast abscess. So pain, fullness, fever with or without chills, swollen or red tender breast. So what is the treatment of breast abscess? Is broad spectrum antibiotics, anti-inflammatory drugs, breast support, feeding to continue. Advise the mother to continue the breastfeeding. And untreated or undertreated neglected cases may lead to abscess formation. So here you can see in this picture. So breast abscess is usually with high fever, chills, localized swollen, red, warm, tender, and indurated mass with fluctuation. So the treatment, if these all are symptoms present, then incision and drainage, that is IND, and supportive therapy, as same as that of the treatment which is used in the mastitis case, we give it to the patient. Now, breastfeeding to be resumed as early as possible. This is the main point. We should explain it to the mother. Now, coming to the nursing strike, the baby suddenly begins to refuse the breast. So, major causes is the mouth pain from teething or fungal infection, ear infection which causes pain while sucking, pain from certain breastfeeding positions, and being upset about a long separation. So, these all are the causes of nursing strike. Now, coming to the remedy, try another feeding method temporarily to give your milk, such as cup, dropper, or a spoon, and then keep offering your breast to the baby. If the baby is frustrated, stop and try again later. Try different various breastfeeding positions. Focus on the baby with all your attention. Comfort him or her with extra touching and cuddling. Try breastfeeding while rocking and in a quiet room free of distractions. So these are the remedies we should give or advise the mother regarding the nursing strike. So how do I know if the infant is breastfeeding effectively or not? So, like baby's content after feeding, these are the signs we should explain the mother. The baby's content, audible swallowing during sounds are swallowing sounds are there during feeding. Mother's nipple are not sore, or more than three times stools are passing after 1 day. No weight loss after 3 days, and breast feels less after every feed. So these are all the signs of the baby is taking effective feeding, breastfeeding. How do I know when the milk has come in? सो मदर्स यूजुअली आस्क, तो हमें बताना पड़ेगा कि मेरा कैसे, मुझे लगता है मेरा दूध कम आता है, तो मदर को हमें ये एक्सप्लेन करना है इफ द वेट डाइपर्स आर मोर देन 6 per day, येलो सीडी stools are there by day 4 or 5, breasts are noticeably larger, feel firmer and heavier. Mothers may being to feel let down reflex, like if the baby is in a lap of the mother, the milk is coming out from the breast may leak between or during feedings. So these are the you can say the hints or signs that the you should explain it to the mother that your milk is sufficient to come out and it is sufficient for your baby also. Now, perception of insufficient milk supply. So it is seen that very common 50% of the breastfeeding mothers, they are having this perception. So common cause of this is weaning, that their baby starts taking another formula feed, or the some other things are given to the, like mashed banana and other things are giving to the baby. So the most common cause is weaning of this perception. Only about 5% of the women will not produce adequate amount of milk for their babies. So next, reasons a mother may falsely believes her milk supply is insufficient. So lack of education about normal breastfeeding patterns, behaviors, soft breasts, growth spurts that instigate need for frequent nursing, inability to express large volume of milk, does not express letdown, frequently fussy infant but gaining weight normally. So these all are the reasons that a mother may believe that her milk is not sufficient for the baby. So another cause is like anything that limits the infant's ability to extract milk effectively and frequently, such as separation of mother and infant, schedule interval between feedings, poor latch, early use of pacifiers, premature baby, supplementation with the formula, and delayed milk ejection secondary to stress and pain. So these all are the causes of decreased milk supply. So what we can do is reassure the mother. If the infant is gaining weight well and stooling and voiding properly, then reassure the mother her milk supply is adequate. Discourage supplementation or any other weaning method. Review normal pattern of breastfeeding, elimination and weight gain. So this is all about the reassurance we should give to the mother. Now Summarize all these common breastfeeding situations is common breastfeeding situation are preventable with proper breastfeeding assessment and prenatally care and postnatal care. Those that are not preventable are often treatable and should not induce weaning. Mother should be educated prenatally or postnatally about breastfeeding expectation and common preventable situation, that we should be very much aware about the causes and the factors which are leading to perception of having low milk supply. So these all should be properly understood by the nurses, and according to that, proper counseling, effective counseling is to be given while handling these breastfeeding problems. Physicians should be able to identify common breastfeeding situations, and the treatment is to be given accordingly. And more complicated breastfeeding problems can be referred to a lactation specialist. So this is all about the common breastfeeding problems and their possible solutions. So this is my contact, and if you have any problem related to that, you can contact me. So I hope this video help you to properly counsel the mother and to identify these problems and possibly give solutions to the mothers. Thank you everyone. Thank you for your patient listening.